Let me now turn to our guest of honor this morning, the Honourable Julian Fantino. He is Canada's Minister of International Cooperation and Member of Parliament for the riding of Vaughan. I have known and respected the Minister for years in his many different roles and in his commitment to public service. I'm a great admirer and feel privileged to be able to work with him. Minister Fantino has served as Associate Minister on National Defence, as a Minister of State for Seniors, and was first elected to the House of Commons in November of 2010. He was re-elected in May 2011. And I hope, Minister, the elections don't have to occur that frequently from this point on. Prior to his election to Parliament, Minister Fantino had a distinguished career serving almost 40 years in law enforcement, which is where he and I met, including as Chief of Police in 3 cities, regions in Canada, as well as Ontario's Commissioner of Emergency Management and several other public service leadership positions. He is now very active in local and international victims' rights groups, especially protecting children from sexual exploitation and abuse. He is an honorary member of the Canadian Crime Victim Foundation, is involved in community organizations, particularly with programs aimed at making organized sports accessible to disadvantaged children. And he volunteers and supports a number of long-term care facilities for seniors in Vaughan. Each of these areas of personal interest to him speaks to this man's character and his values as a human being. Minister Fantino has received many awards for his work, including the following, amongst others: the Human Rights Awards from the International Association of Chiefs of Police, the Outstanding Service Award from the Canadian Safe Schools Network, the Consumer's Choice Man of the Year Award, the Toronto Award. He was appointed to the Order of St. John, as well as a member of the Order of Ontario and a commander of the Order of the Police Force. In 2009, he received the 40-year Police Exemplary Service Bar for his extensive service. Minister Fantino was born in Italy and immigrated to Canada at age 11 and represents what so many immigrants do to the success and to the contributions of our country. Minister, I was particularly struck in a speech you made 2 weeks ago regarding reducing poverty. And the way you said it was, reducing poverty for building tomorrow's markets, which included the following statement: when poor countries' expectations of education and jobs go unmet, opportunity can quickly turn to despair. I know from our personal involvement together that these words and doing something practical about this problem reflect your core personal views and beliefs. And this is why all of us are truly grateful for your presence here today and for your willingness to lead in public service. As a minister of our federal government, we feel very comforted by your holding this position and your role in your current portfolio. May I now invite you to the podium to address our esteemed colleagues, and we look forward to hearing your thoughts and ambitions.
Well, good morning, everyone, and let me, first of all, welcome all of you as well to Ottawa. Hopefully the weather is suitable for this time of year in Ottawa, and I hope that you will, in fact, enjoy your time here. Joe, Mr. Rothman, thank you so much for your very kind introduction. It means a lot to me to be here with you, and all of you, actually, at this very important conference, a meeting of the minds in order to find new and innovative ways of dealing with some of the more nagging, difficult humanitarian issues that so many people around the world face. And we, in countries like Canada, are so privileged to live in the kind of comfort that we do. But thank you also, Joe, for your leadership over so many years. You're reaching out and helping those in greater need, and the example that you have shown are really inspirational to all of us. And here you are again, quite involved in a very important aspect of reaching out with partners to help those in greater need. And I feel privileged to be part of this, so thank you. I also want to highlight the fact that in whatever endeavor, and it was pointed out here, the people that do so much work to bring these events together, the kind of planning, the work that goes into these conferences, and the moving forward of great initiatives, and the coming together of great minds and similar interests, is really a daunting issue. So I too want to thank those who no doubt have worked so hard to bring forward this very important gathering to enable us to deal with some of these very profound issues. Good health is really a foundation for all other good things that come in life. It is a universal truth that applies equally in all parts of the world. With good health, children are more likely to learn and to later capitalize on their potential, becoming integral parts of their community and economy, and of course their country. With good health, parents are better positioned to provide for their children and to also contribute to the economic growth that helps societies thrive. With good health, the challenge that holds people back are more easily overcome. Both you and I know of the extent of these challenges in the developing world, where roughly 287,000 women still die of pregnancy-related causes every year. It's a staggering figure just to be able to imagine that. Where 19,000 children per day are dying before they turn 5 years of age. And where poverty is keeping far too many people from the health care they need to just basically survive. Of all the Millennium Developmental Goals, those that relate to maternal child mortality are certainly making the slowest progress, and about something that we need to do a lot more. This is why Canada has focused so much on maternal, newborn, and child health over the past several years. In my brief time as Minister of International Cooperation, I have already witnessed some of the difficulties people in developing countries, those very, very needy people, are facing and have to endure. In Africa this past September, I met many mothers of young children. They spoke of having barely enough food to keep their kids alive, and of walking for miles and miles with sick children in their arms, desperate to find them the health care they so desperately needed. These experiences underscored for me the importance of continuing to focus our development efforts on mothers and children. Canada has led the way in efforts to keep mothers and children alive and health by gathering support amongst the G8 countries and other key donors and involved partners, including the private sector. In 2010, as part of the G8 Muskoka Initiative on Maternal, Newborn and Child Health, we pledged an additional $1.1 billion in funding to help this effort, while maintaining our existing commitment of $1.75 billion over 5 years. In total, $2.85 billion committed is to basically achieve one shared goal: significantly reducing preventable deaths amongst mothers and children. CEDA, the Canadian International Development Agency's approach to our work on maternal, newborn and child health focuses on reducing the primary causes of mortality for both women and children. For mothers, most deaths occur during childbirth or in the first week after a child is born. Underlying anemia, malaria, HIV infection, and undernutrition are also key risk factors. As you well know, a mother's malnourished state not only increases her risks of complications during childbirth, but also poses risks for her child as well, including low birth weight. For children, the main causes of death includes infection, particularly sepsis and pneumonia, preterm birth, and breathing complications. They die because they are poor, isolated, without access to routine immunization or health services. Their diets lack sufficient vitamin A and other essential micronutrients, and they live in circumstances that allow pathogens to thrive. To help overcome these challenges, CEDA's approach to the maternal newborn child health focuses on three main core parts. The first is strengthening health systems to ensure that countries are able to deliver quality services. A woman should be able to give birth with a skilled attendant at her side and at a facility, hopefully nearby, not 100 kilometers away, as is the case in Niger, for example. And the health system should be able to treat her child's pneumonia or provide advanced care to her newborn, as far too many die within their first week of life. In Tanzania, CEDA supports and continues to help more than 43 million people access health care services through 4,600 local health facilities. 8 years ago, 46% of babies were born in a health facility and were delivered by a skilled birth attendant. That number rose to 51% in 2010. Measured progress for sure, but progress nonetheless. The second path in our approach is to reduce the burden of disease, focusing on prevention and treatment approaches. 6 preventable conditions and disease account for more than 75% of under 5 deaths. And pneumonia, diarrhea, and malaria alone account for 58% of all child deaths. For pregnant women, malaria, anemia, and HIV are important risks, and they account for 20% of maternal deaths. Reducing the burden of disease is therefore critical to reducing the unacceptable rates of maternal and child mortality. The Canadian International Development Agency supports the Global Fund to fight AIDS, tuberculosis, and malaria, whose programs are estimated to have prevented 8.7 million deaths from these 3 diseases since 2002. And our work to help train more than 2,000 health workers in Afghanistan has translated into polio vaccinations for more than 7.8 million children in one of the last countries of the planet where polio is still endemic. And here, a vote of thank you and appreciation to the Bill and Melinda Gates Foundation for their efforts, along with the Rotary International organization with whom we have partnered to eradicate polio, the final push, if you will, in that particular pursuit. Finally, the third path in CEDA's approach to the Muskoka Initiative is to improve nutrition, which is an underlying cause of 35% of maternal and child deaths. We're working to ensure that women receive the nutritional supplements and information they need while pregnant, as well as necessary iron and folic acid to help with the developmental stages of the child. Breastfeeding is promoted along with nutritional information, so the right foods are introduced to children at the right time. By supporting the Micronutrients Initiative, our efforts have improved child development and nutrition. Through the distribution of essential vitamins and minerals, we are helping to prevent an estimated 470,000 child deaths and mental impairments in 200,000 newborns. Our efforts in saving the lives of mothers and children are delivering measurable results, and we, all of us, working on this particular case situation and doing what we're doing, should be very proud of the results that we are achieving. But obviously, much more needs to be done. But we also know that overcoming the challenges that exist calls for other innovative approaches. As the world moves ahead on global health issues, Canada is keen to pursue new ideas that will allow us to make even greater progress in reaching our developmental objectives. Grand Challenges Canada is a perfect example of an organization that thinks outside the proverbial box to find solutions to current developmental challenges. The Saving Lives at Birth program is saving the lives of pregnant women and newborns in poor communities. Creative innovations such as solar power suitcases that allow a source of power 24 hours a day, or the Odon device, which allows for safer and easier assisted births, are all helping in saving the lives of pregnant women and their newborns. The Saving Brains program is promoting early childhood development and the formation of long-term human capital. The Global Mental Health Program is expanding access to mental health care in low and middle income countries. And the STARS in Global Health Program is supporting bold ideas that are having a big impact on global health. Bold ideas such as the $2 clean birth kit, a cost-effective way to ensure women and their newborns are safe, hygienic, and of course the resource available to them in poor situations, are able to have a very significant outcome, achieving healthy births. I understand that some of the 17 Canadian winners of the STARS and Global Health Program are with us here today. And to all of you, congratulations. The Government of Canada is pleased to be supporting your bold and creative ideas to tackle health challenges in the developing world. Each of these programs and those of other Grand Challenges teams in this room represent an innovative approach to global health. A new way of solving stubborn problems, or the Grand Challenges itself puts it of overcoming a specific critical barrier that, if removed, would help solve an important health problem in the developing world. This really is the definition of a grand challenge. And it is why the innovative ideas that you bring to the table are so critically important. Innovation in global health is a critical piece of the development puzzle. And if we are to accelerate progress in achieving Millennium Development Goals 4 and 5, reducing child mortality and improving mental health, innovation will have to figure prominently in all our combined efforts. Because more than ever, innovative responses are needed that encompass new development approaches, new partnerships, and enhanced research and development. We need to encourage new ideas and new thinking. We need to test these ideas in realistic conditions, bring innovation to operational scale, and harmonize our efforts. And we need to find the ways and means to get these innovations out in the front lines of national health services across all the countries where the global health issues, the burden is the highest. Innovation is about creating new ideas that drive improvement, renewal, and change. We know that the best way to find solutions to persistent developmental challenges is to focus on cost-effective, scalable, and rigorously available projects. To find new solutions, we need to think about innovation in three key phrases. And these are starting from the proofs of concept that have the potential for game-changing results, moving towards investing for impact to field test promising project concepts, and finally bringing new ideas from impact to scale by widely implementing successful project innovations. This is the new development frontier, and a conference like this one that brings together the brightest minds in scientific, technological, social, business, and government circles is showing the way. You truly are not only innovators, but you are strategic leaders. Innovation is a key building block in what we at CETA are trying to accomplish in the developing world. Moving ahead, we will be looking for ways to increase support for novel funding approaches to help solve development problems. And the agency will explore new ways of not only supporting new financing, but also of using the expertise of the private, not-for-profit, and academic sectors. These approaches allow us to tap into local ideas and the talent that's there, local innovators, as well as those of globally minded citizens around the world who saw a problem in another country and said, I can do something to solve that. We're also looking at ways to test proven innovative concepts in our existing programs and, if appropriate, scale them up. Being responsible stewards of taxpayer dollars, we must bank on smart ideas that hold the promise of improving lives for the poor and recognize that when they do not succeed, we must learn. As Henry Ford once said, failure is simply the opportunity to begin again, this time more intelligently. In the spirit of banking on smart ideas, I am pleased to share with you that CIDA, the Canadian International Development Agency, and Grand Challenges Canada are establishing a new relationship to spur innovation and progress. As one example, we have been watching the promising leads emerging from the Stars of Global Health program. We want to build on the best from this program to further improve health results in the developing countries. Through this relationship, we will advance and showcase Canada's commitment to innovation for developing impact. CIDA works towards the more difficult aspects of this global humanitarian challenges that we face. But we will work closely with Grand Challenges Canada in the future in building on this track record of success and its pipeline of good ideas to further our collective focus on health-related progress. Ladies and gentlemen, at its core, development will always be about people, about investing in their core capabilities, and in supporting the development of societies that will allow them to maximize their potential and live healthy, happy, and dignified lives. Your innovations can and will be part of this process. Our collective challenge is to work together to develop and test new ideas, scale them up, and roll them out into the hands of nurses, pharmacists, community health promoters, and others. We can and should be proud of new ideas coming to fruition, but we are all much prouder when these ideas make a difference in the life of a young mother or save a child's life. It is that basic. Global health has made progress, and we have all been part of it. But much remains to be done before women and children in developing countries are healthy. Progress in these grand challenges is critical. The Canadian International Development Agency looks forward to working with new partners, such as Grand Challenges Canada, and pursuing current partnerships with Canada's own International Development Research Centre, your governments and organizations like the Bill and Melinda Gates Foundation to develop innovative solutions to development problems. Thank you, and may your time in Ottawa and in this conference be a future opportunity for you to take the challenges and the solutions to new heights. I was intrigued by a book that Dr. Fisher just gave me, and merely reflect on the titles. I haven't had the opportunity to get into the text, but it's titled The Grandest Challenges, and I guess it sums it up in this quote, which I find very compelling. Taking life, saving science from lab to villages. Thank you all, and may your time here be rewarding indeed, and may you have greater opportunities in the future to exercise the kind of learning, your commitment and dedication in a way that you truly will continue to do great work, saving lives. There's no more noble cause. Thank you, and may all of you be blessed.
Minister Fantino, on behalf of all of us here, I really want to thank you for your words, and even more so for your leadership on the development file. Your focus on results is obvious, and very importantly, you're taking the long-term view. And in your remarks this morning, you've really emphasized that CEDA, the Canadian International Development Agency, and Canada is at the table with leadership on innovation in development, that we are and intend to be an innovating nation in the development file, and you can certainly count on Grand Challenges Canada and the partnership that you mentioned. On behalf of everyone here, for your leadership, your focus on results, which are so desperately needed in this area, your taking of the long-term view, you're not accepting conditions as they are, but trying to make things better through innovation, and for your emphasis, which will resonate with everybody in this room, on innovation in development and in global health. On behalf of everybody here, I thank you.